All right. Well, welcome in parents and everyone else. We are so excited to have our third and final peers session for this semester. I am Erin Baptiste, the Special Education Director for DeKalb County Schools. And we are here to welcome you in to our session. Tonight's session will be about Medicaid waivers. And let me back up a little bit. Our peers stands for Parent Education Empowerment Resources and Support Sessions. This is our third session for this year, and we do anticipate having some additional sessions next semester, which I will get to in a minute. Our peer sessions are a new initiative designed to educate you all and to promote engagement and increase parental access to meaningful community resources. A lot of these sessions are geared around parental feedback in terms of how we plan and who we invite to, help facilitate some of these sessions. So your feedback is very important to ensure that we are touching on the topics that are most important to you all. Moving forward, as I said before, we do plan to have our fourth peer session, and it's currently planned to take place in January. And our topic right now is understanding child fine, Section 504, and hospital homebound. Again, that's anticipated to take place in the new year in January. We will also plan to host an in-person. This will be an in-person peers session, and this is going to actually be a transition fair, which will take place an anticipated date of March 22nd, and the location right now is Redan High School. So please be on standby. We will share some additional information moving forward to make sure the dates and location is accurate and that you all will be able to attend our in-person session. We do want to thank and introduce our staff and planning team for these sessions, particularly for tonight on the Medicaid waivers. And first and foremost, we have Lisa Lake. Miss Lisa Lake is our parent transition liaison. We have Miss Rolanda Johnson, a senior coordinator, Miss Danielle Howard Thomas, another senior coordinator that has been instrumental in supporting the transition series, the transition services series. And then we also have our transition liaisons, Miss Pamela Gordon, Latanya Wilson, Rodney Allen, and John Norwood. Without further ado, I'm going to hand it over to Miss Lisa Lake, who will introduce our guest speaker tonight to talk about Medicaid waivers. Thank you all so much for being here, and we do appreciate it.
Thank you so much, Dr. Baptiste, and welcome everyone to this session. I'm just going to give you a couple of reminders as well. We are going to have a question and answer session at the end at 7 o'clock. So if you have questions, please make sure you stick them in that Q&A section. That's it should be at the bottom of your screen, or you can put them in the chat as well. And we will start answering those questions at 7 o'clock. The speaker will be able to answer any questions that are in that chat area. Also, we are going to issue a survey at the end that will be put into the chat as well. And so be looking out for that survey link that I'll be posting it towards the end. And without any further ado, I want to introduce our speaker for tonight. Her name is Patricia Lanaspa. She is from Parent to Parent of Georgia, and she will be helping us navigate through the new options waiver and the Katie Beckett waiver. And so I'm just going to turn it completely over to you, Patricia, and thank you.
Hi, thank you, Lisa. Thank you. Good evening to everybody that is here waiting to hear about this great presentation. The topic, I love it, absolutely. I think it's very useful, both the deeming waiver and the now and come waivers. Sometimes people get confused around all the paperwork and all the different programs that are available when a child ages out of his high school. So I hope that this presentation really makes a difference. The presentation today is going to be talking about the deeming waiver and the now and come waivers, which I think is a topic that's going to be very useful, especially for those families that have students that are preparing themselves to transition. It's not only the transition that is going to happen in terms of education, but also the health transition. So we're going to talk a little bit about what's available for those students and children that are aging out of school. So as I was mentioning, I work in Parent to Parent of Georgia. We are the parent training and info center in the state. Okay, and we do a bunch of things. We do trainings like the one that DeKalb County has asked for us to provide today. But we do have what we call a special needs database. If you go to our website, you can find it, and you can find every type of providers imaginable there. Like if you want somebody specializing in nutrition, or if you want providers for diapers, etc., you can find them there in what we call, again, the special needs database. Then we have a roadmap. The roadmap is basically many sessions with topics that have been developed there, publications, materials taken from different sources. And again, it's about health, transition, early intervention, education, etc. Then we have a program of supporting parents where we can match one family that have a special needs child with another one that is requesting that emotional support, basically. Of course, we have one-on-one assistance. This means that anybody of you that today leaves with questions and we don't have time to answer them, or tomorrow they just wake up and think, okay, I have more questions about a different topic, they can always call us, talk to any of our coordinators, and we can give that assistance by telephone in a personalized, tailored way to each of you. So we have the Navigator project. Again, this is support groups that we have, okay? We offer these free trainings, and again, there are online opportunities. There are many topics that we have created what we call archive webinars, specifically, for example, on the topic of Kathy Beckett. I'm doing the presentation streaming now, but there's an archive webinar that if you go to our website, you can listen to it and hear it on your own time. So that's very useful. If you want to contact us, this is the number, okay? This is our website, and if you just forget, just Google Parent to Parent of Georgia and you will find us. Okay, so I hope you really call us anytime with any situation or question that you may have. So there's
Patricia, we don't see your presentation.
So my apologies, that was just the introduction. So we are going to start learning what we're going to learn today. So we're going to touch on Medicaid basics, the eligibility for Medicaid, the services that are provided through Medicaid, and then we are going to end with the now and comp waiver. So first of all, some definitions. What is to waive? So we are talking about waivers because when we waive is we don't enforce something. So there is a rule, and if that rule is waived, it means that we are not going to enforce any qualifications that may be needed to satisfy that rule. For example, they waive my fee to belong to the club. That means that I can enter the club and I don't have to pay a fee because they are not enforcing it, or they gave me a pardon, or they made an exception for me. So that is to waive. That's very important, okay? Eligibility, everybody knows what this is, but it's very important also to know that there are certain rules that you have to comply with or satisfy the appropriate conditions in order to be eligible to one program or another one. When you are entitled or you have entitlement, means that you have the right to belong to something or to have something, okay? And categorical, it belongs to a category, it is explicit and it's direct. And non-entitlement is the opposite of entitlement, meaning that you don't have the right to have something, okay? So, so I'm going to do the question of the poll and I'm going to answer it myself. So what is Medicaid? The options are a government health program, a federal state partnership program, and it covers doctor visits, hospitalizations, diapers, etc. So what is Medicaid? Actually, Medicaid is the three things together. So it's health, it's a government health program. So this is not private insurance, this is government insurance. Who provides this? Is a partnership between the state of Georgia and the federal government, okay? So this means this is very important because Medicaid, if you move to a different state, you are going to, if you qualify, you're going to have Medicaid wherever you travel, wherever you choose to live. But the partnership is going to be between the state where you reside and the federal government. And then what does Medicaid cover? Everything, everything related to health. This is the most complete program versus, for example, having private insurance. And why I say this, because private insurance sometimes they don't provide many services, but Medicaid, if you need the service, you are going to get it. If you need that doctor visit, if you need that consultation, if you need to be in the hospital, you're going to get that. So it covers the doctor's visits, stays in the hospital, medicines, diapers, etc. So it's a very, very complete program. Most of you may have already this for your children, okay? And as we were saying, it's medical assistance, okay? It's federal and it's administered by each state. And this, how do you qualify? How does one child or one person qualify for Medicaid? Well, there are certain eligibility qualifications that are being asked, okay? And that requirements are based on federal regulations and also on the state plan, okay? So I'm going to stop a little bit here. If you it's not being said here exactly on the on these slides, but I want to remind to the parents and people that are listening that you can have there are three ways that you can have Medicaid, okay? So the first way is going to be the classic Medicaid, which is the Medicaid that I call classic, but actually is what we call the low income Medicaid. So if your family has a child under 19-year-old and you are below certain income and resource limit, your child may qualify for Medicaid. And here, when I say qualify, is for Medicaid, and this is for all children, not only for children with disabilities, okay? Now, if you have a child that has a disability and you decide that you as a parent want to apply for the benefits of that offers the Social Security Administration, if that child is deemed or is considered or is approved as having a disability according to the guidelines of the Social Security, the SSI or the Supplemental Security Income comes together hand in hand with the Medicaid. So again, the first way to have Medicaid is for every child under 19, families low income, they can have Medicaid. Family has a child with a disability according to the guidelines of the SSI. If the child is approved for SSI, immediately that child is given Medicaid. And the third Medicaid that we are going to talk today, the third type of Medicaid, is exactly what we call the Beckett, which is the topic of today. So this is again very important. If any of you that are here has questions about, I have another, for example, I have my son that has a disability, but my other children don't. How do I know if I can qualify for Medicaid for them? Absolutely, you can call me tomorrow, you can call our office and we can guide you further. But those again are the three ways to have Medicaid in the state of Georgia. So I don't know how many of you have read or heard or know the story of Kathy Beckett. Kathy Beckett is this young woman that you have in the picture. And what was happening is that Kathy has a disability, was mainly a physical disability. She was, I think she had some sort of tracheotomy, so she had scissors. So the story goes that in order to have Medicaid, the mother had to put Kathy Beckett in a hospital because they didn't have a common Medicaid. They didn't have the low-income Medicaid. They didn't have Medicaid at all. But you know here that if you enter the hospital and you don't have insurance, Medicaid, emergency Medicaid could cover your cost. So the mother said, why should I put every time that there's an emergency, I have to take my child to the hospital in order to have Medicaid? If I have a Medicaid, I can keep her at home and I can use that Medicaid and she doesn't need to be hospitalized. So it didn't make sense to that mom and to Katie to have to go into the hospital to get the benefits of insurance by Medicaid. So this is how the Kathy Beckett came to be. Okay, so basically, this again is the mommy. Yes, that's the mom and Katie. And this again, this is the beautifulness, I call it, for the Kathy Beckett. Kathy Beckett and Demon Waiver is the same thing. We can call it in any of those ways, okay? But it's basically the same. And it's also known specifically more in other states, not so much in Georgia. It's called as TEFRA, TEFRA, which is, tax equity, blah, blah, blah. So it's an eligibility waiver. So you have to comply with certain characteristics to be able to apply. And what it happens here is that it allows the state of Georgia to waive, in other words, to ignore, to not take into account the income and the resources of the parents of a child with a disability for the purpose of Medicaid. So again, remember, you have the Medicaid for low income, then you can apply for SSI, and if you have SSI, you are going to have Medicaid. But the problem is that both SSI Medicaid and low-income Medicaid, they are going to look at the income and the resources of the parents. And the deeming waiver is going to waive. So in other words, they are not going to look into how much money you get a month, how much money the parents earn, how many resources you have, how many cars, how many houses. They are not going to look at that. They are just going to look that the child has a severe disability, or we're going to see the guidelines now, and then they are going to give that Medicaid to that child. So it's very, very important. So what is eligibility again for Katie Beckett or deeming waiver? So they have to meet the income and asset requirement, which is very easy, okay? Really, they are not going to look into that too much. You have to be under 18 years of age. You must have a disability or chronic illness, and you must meet what we call the institutional level of care criteria. Okay, so I'm going to, let me see 1 second. Yes, we are going to elaborate a little more on what is the institutional level of care in a moment, in the next slide. Another thing, it must be cost effective, okay, and it's appropriate to provide care to the child at home. So the purpose of Kathy Beckett, again, is not to have to take the child to the hospital or to a nursing home or to any kind of institution so he can get the care. That child, the purpose is to keep him in the home, to keep him in his natural environment with the rest of his family and get the care that he needs in that natural environment. And it must be cost effective. So you can't, you're going to see that Kathy Beckett program is not going to pay for amounts that go beyond what the Medicaid, the common Medicaid is paying. So it has to be cost effective. You're not going to get tons of money because you are in this program, okay? So what we were talking again about the institutional level of care, they are in red. So what is institutional level of care? And this is very, very important. Okay, so this is for children that have
medically complex conditions which require placement in a healthcare facility to receive the necessary health professional services if they were not cared for at home or in the community. So in other words, we are talking about children that have severe disabilities or they have intellectual disabilities. But for example, just to give you an example, let's say that your child only has attention deficit disorder. So the child is doing good academically, child has no physical impediments, etc. The only thing is that he's taking medicines for ADHD or ADD every day. Well, that is not a complex condition, and that is not a reason for the child to be cared in an institution. So that child with only, and I emphasize on only, ADHD is not going to qualify for the deeming waiver, okay? So, so this being said, I'm going to dig a little more into what is a skilled nursing facility or an intermediate care facility or ID facility. So a skilled nursing facility is the one that gives exactly that, a skilled nursing. And a skilled nursing is when you have, for example, a child that is bedridden, usually is non-ambulatory, children that may have a tracheotomy or they may need a ventilator to breathe, or they may have a G-tube because they can't eat, things like that. Those are skilled nursing facilities, okay? An intermediate care facility is something different. We are talking here about ID facilities. ID is the acronym for intellectually disabled people. So this again, this is people that they don't need a tracheotomy, they can eat by themselves, but they usually need 24/7 care. So it can be, for example, a child that has cerebral palsy, a child that has an autism level 2 or level 3. So you can't leave that child by himself 24/7. You need to monitor for many, many reasons, but that child has intellectual deficits usually. So this is what we call intermediate care facility or ID. It's for that specific type of children. So digging a little bit on the skilled nursing facility, okay, this is again children that require skilled nursing so it's not that they need to have skilled nursing and rehab services. They either require skilled nursing, and if they don't require that skilled nursing, they can require rehab services. And rehab services is what we commonly say therapies. So those are therapy services on a daily basis, 5 to 7 days a week, both at home and at school. So it's a child, for example, again, taking the case of autism, it's a child that has autism level 2 or level 3, but plus on that has speech impediments. So that child is getting speech therapy, rehab services for speech, or that child is having ABA therapy, that's for behavior, or that child is having occupational therapy, again, that's a rehab service. So you as a parent, when you do the application, you will have to show that your child is either requiring skilled nursing or he's getting rehabilitation services or therapies from 5 to 7 days a week. So that's a requirement, okay? Now, there are some ways, again, that we mentioned also children that have intellectual deficits. And you may say, well, all the children have intellectual deficits, the children that are on Cathy Beckett. And I'm going to tell you, no, not all the children that have Cathy Beckett necessarily have an intellectual deficit. Let me put you, for example, the case of a child that has a spina bifida, or excuse me, spina bifida. A spina bifida is mainly something, let's say, a little more physical than mental. So that child may have normal intelligence, but the impediment can be because the child is incontinent, the child is not walking, is in a wheelchair, etc. So that child will qualify for the Cathy Beckett. There's no doubt around that, but that child is not going to qualify in the terms of intellectual disability, but still is going to get the Cathy Beckett, okay? So how do you as a parent can prove to Cathy Beckett that your child is eligible or your child needs or fits the profile of intellectual disability intermediate care? So if you have an IQ score that is under 70 points, IQ means the intellectual quotient, or what we call the intelligence, the level of intelligence that a person has. So remember, parents, that the IQ usually is done after the child turns 8. Before the child turns 8, what we do, what psychologists do, excuse me, is functional assessments, adaptive behavior assessment, etc. It's very difficult that you will find an IQ for a child that is under 8. And the reason is because, you know, the brain has still time to develop. But if your child is more than 8 years old and you do not know how much is his IQ, parents, I would recommend that you take your child to a psychologist and get that IQ testing done as soon as possible. Some parents may be thinking, well, but I do have the diagnosis of autism or the diagnosis of cerebral palsy. Why should I get the IQ score? And I'm going to answer you, because you need it not only for the deeming waiver, but you're going to need that score for the now and comp waiver. So the IQ is a must. After 8 years old, you need to have an IQ for your child. You need to have a score written done by a psychologist in order to be able to apply for different programs. Now, again, if the child is small, what they do is they look at 3 areas of functional skills. So they can be adaptive, it can be emotional, it can be cognitive, physical, etc. They have to see that the score is under 70. You're gonna learn here that 70 is kind of the magical score for everything. And then specifically for children that have autism, if you do not have these scores, but if you have a report done by a psychologist talking about the CARS, which CARS is the acronym for Childhood Autism Rating Scale, Childhood Autism Rating Scale. If your child is scored under 37, he's eligible for the naming waiver. Or maybe the psychologist didn't do the CARS. Maybe the psychologist did the GARS, Gillian Autism Rating Scale. Okay, this is another test. If the score for the GARS is more than 100 of 21, then your child is going to be eligible for the deeming waiver. So again, deeming waiver is going to look at the disability, how much that disability affects the child. They are going to look at how many sessions of therapy that child is having during the week. They're going to look at IQ scores, functional skill scores, and if the child is on the autism spectrum, these are the 2 testing that you have. If there's a parent there that is thinking, well, I don't have the CARS or the GARS, I have only the diagnosis of autism done with another instrument, for example, the ADOS, which is the Autism Diagnosis Observation Scale, again, acronym for ADOS. ADOS is not enough. You have to get specifically the CARS or the GARS. That is the way the requirement is written inside the deeming waiver, okay? So we were talking also that you're not going to get tons of money. And in fact, deeming waiver is going to look at the cost and it's going to say, well, is this effective for us, for the government, for Medicaid to cover the cost of this health for this person? And this is more or less what is being, what is the cost per month, okay, for a person who lives in an institution. So right now, if you're looking at the Medicaid rate for somebody who is in a skilled nursing facility, the monthly average is this one, 5,280. And if you are in an intermediate care facility or in a facility for people that are intellectually disabled, the maximum amount is 14,700, etc. So this means that the cost that your child is going to require and the cost that you are planning to in a certain way use for him, for that child in terms of care per month cannot exceed either one of these categories, okay? This is important because there's right now, without seeing it, it's a little bit difficult for you to understand, but there's a form that is part of the Cathy Beckett application, which is called the cost effectiveness form. And there, the parent is asked to give an estimate of how much they are asking Medicaid to pay. So in other words, you cannot put or you cannot ask Medicaid to pay for, let's say, 15,000 a month. Why? Because the cost maximum per month is 14,000. So be very careful with this one, okay? The cost effectiveness. Now, how to apply? You know, if you want to go to gateway.ga.gov, you can do it there. You can call our office parent to parent, just ask to talk to any coordinator and she can email you the applications. And the advantage of calling parent to parent is we are not only going to send you the applications, we are going to send you the link to a recorded webinar that we have also. We are going to send you a cheat sheet. We are going to send you, so you can understand everything that I'm saying here is going to be written on that cheat sheet. And also you're going to have a sample form, which has already been completed. So you don't have any doubts when you parent are trying to complete this. If you want to do things by yourself, don't call us. You can call the centralized Cathy Beckett team and they can send you via mail an application. So there are many ways that you can get it. So, and what means to have Cathy Beckett? It means that you have Medicaid. So you can take your child to the doctor appointment, hospital, you can get the medicines, incontinence supplies. Be careful, this goes only until 21. Your child can get the therapies. If he needs something or in terms of orthotics, prosthetics, etc., medical equipment, a rolling bed, an adapted bed, etc., lab test, everything is going to be paid. And remember, Cathy Beckett, and I emphasize, Cathy Beckett is Medicaid. So as Medicaid, I mentioned something earlier before. I said, if your child needs it, if your child needs the service, if your child needs the consultation, if the child needs the treatment or the drug, and emphasis on and the doctor fulfills the requirements of Medicaid, fills all the forms, justifies that treatment, that consultation, etc. Under EPSDT, this has to be provided. This is not an option. So be very careful. Oh, Medicaid is not covering this or is covering that. Well, sometimes when parents say Medicaid is not covering, I'm asking them, well, did your doctor or did the pediatrician or did the specialist fill all the forms to ask and to justify why they are using this medicine or this treatment versus the other? And sometimes the doctors are not doing that very well. So, but it is part of, again, Cathy Beckett is Medicaid, and Medicaid is covered by this statute here, the early periodic screening, diagnosis, and treatment. So if a child needs it, he's gonna get it, okay? Remember, this is, again, Cathy Beckett only goes into from 0 to 21, okay? Excuse me, the EPSDT goes to 0 through 21. Okay, so what happens if you are denied Medicaid, the deeming waiver, Kathy Beckett? You can always appeal, okay? But basically, the two main reasons why you may be denied or your child may be denied is the level of care. For example, remember I said very fast, but I mentioned it, 5 sessions of therapy a week. If you don't get 5 sessions of therapy a week, you are gonna get denied, okay? That sessions can be, for example, 3 sessions in the school, 2 sessions outside the school, that's 5 sessions a week you are in. But if you don't get to those 5 sessions, that's level of care you're gonna be denied. Or technical, maybe you didn't provide all the forms, maybe you didn't provide the copy of the private insurance that you have, etc. Because those things you have to provide when you do the application. So it can be something technical, but usually if the denial is going to be technical, the Kathy Beckett office is going to call you and say, hey, we are missing this, or that, okay? So there's always grounds for appeal. Again, I recommend that if you want to discuss it further, if you have been denied, you can always call us in parent to parent and we can try to figure out why you were denied, okay? So I know that we have the questions till the end, so I'm going to continue because it's 45 and this is ending at 7. So we are going to talk now about the waivers. Yay! Home and community-based service waivers. So this depends on the Social Security Act, the Section 1915C, and it allows states to cover additional services to keep individuals with disabilities in their homes and communities. Okay, each state writes their own plan, which is then approved by the federal government. The waivers don't transfer from one state to the other. So this means that if you are living here in Georgia and you decide then that you're gonna go to Minnesota, you'll have to ask for the waiver there. You'll have to say goodbye to the Georgia waiver and ask for the waiver there, okay? If you compare services, for example, that the waivers offer here in Georgia versus a waiver that is offered in Kentucky, for example, they may be offering different things. One may be offering more than the other, okay? The funding level varies by state. So some states complement the federal funding, some others don't. Some others give a lot of money to these waivers, some others don't. This is not an entitlement program. Remember this word. So entitled means that you are not going to get it immediately because you qualify. You qualify, but you are probably going to go to a waiting list. So, and this is a huge difference. Let's take again the Kathy Beckett waiver. Kathy Beckett waiver is medical insurance, is Medicaid for children that have disabilities and did not qualify for the other 2 types of Medicaid. These home and community-based waivers are Medicaid services on plus on the Medicaid, okay? So they are not immediate. They are offered to you on plus on the Medicaid that you already have. And that's why you have waiting list. Not all the states have waiting lists. If you go to New York, if you go to New Jersey, there are no waiting lists there. There's no waiting list in Idaho. There's no waiting list in California. There is a waiting list in Georgia. There's a waiting list also in Florida, etc. But so they are different things, okay, according to where you live, and they don't transfer from one state to the other. And in Georgia, we do have a huge, long waiting list. So what are these waivers? There are 4, okay, and I'm going to mention them, okay. The first one, source, we are not going to be talking too much about this one because this is more for older people, people that are aging and have functional physical impairments, may have Alzheimer, etc. So that's not our case. The CCSP, again, is for older remains, older adults, we are going to emphasize on these two here. The ICWP is for adults between the ages of 21 and 64 with physical disabilities or traumatic brain injury. And the now and comp waivers are for people that have intellectual and developmental disabilities. This is very important because some people don't know. They only listen and they remember, okay, now and comp, I want the now and comp. But maybe your child does not apply his case to now and comp. And again, for example, as I mentioned before, what about a child that has been in a car accident and is now in a wheelchair and has cognitive impairments? Okay, well, a car accident is considered to be a traumatic brain injury. So instead of placing that person in the waiting list for the now and comp, that is very, very long, I would rather place that person in the ICWP just because it is specific for traumatic brain injury and also because it's a way shorter waiting list. The waiting list for the ICWP is very, very short compared to the now and comp. So you have to be very careful. Who else could be here? For example, the case that I mentioned before, a child with a spina bifida. That child needs support. He's in a wheelchair. He needs diapers. He cannot bathe by himself, etc. Those are physical disabilities. That child is going to go to the ICWP. Now, if you have a child that has autism, that has cerebral palsy together, physical and cognitive impairments, a child with Rett syndrome, Fragile X, all weird things, that Down syndrome, etc. Those people are going to come either to the now or to the comp, okay? So, excuse me. So, for the now and comp, let's see, you must have an intellectual disability or a developmental disability. So again, as I was mentioning, that child with a spina bifida, if he doesn't have an intellectual disability, he's not going to qualify for the now and comp, he's going to qualify for the ICWP. And remember, again, what is a diagnosis of intellectual disability is the IQ. It's intellectual quotient that I mentioned before. It needs to be under 70. So that's the magic number, 70, under 70, that's where you need to get. So again, if your child is more than 8 and you never had an IQ done on him, I would suggest call your psychologist and tell them, hey, I need his IQ to apply for the Beckett, to apply for the now and comp waiver, because you are going to need it, okay? So again, diagnosis of intellectual disability, developmental disability, be Medicaid eligible, so you must have Medicaid, okay? If you don't have Medicaid, don't even start the application because you have to have Medicaid. And you need to require assistance in at least one of these areas, okay? Language, reading, writing, time, number concepts, social skills, self-care skills. So person, in other words, you can't leave that person 24/7 alone. That person needs support on the daily living because the impairments are many, many, okay? And at risk of being placed in an institution. I'm thinking, for example, my son is 27. He has autism level 2. He needs support because he has speech impairments. If I was not here in the house with him, he will have to go to an institution because there's no way my son can survive, make his meals, go to work, pay bills, etc. He's going to place in an institution. So that's why I need to put him in the waiver. So how do you apply for the waiver? You can apply online, and I strongly suggest doing the application online because I know it's complicated. You know, this is a website. You have to create a username, a password, more passwords to remember. Okay. But the thing is, if you complete the paperwork application, and you decide to mail it to the office, then the office has to find somebody inside the office that can put everything that you wrote in the paper, enter into the computer. So it's a duplication of service here, a duplication of entrance, and you waste very valuable time. So try to do it online as much as possible. Again, you can call parent to parent. We can guide you with the application. We can give you tips so you can complete it as best as you can. There are many things that you will need to start the application. Okay, these are the ones that is asking. Of course, you have to show that you have a birth certificate. You must have Medicaid or Medicare. Okay, and if you have both, you have to show both cards. You must have a psychological evaluation. Again, and the psychological evaluation cannot be more than 3 years old. So again, I would say, if your child, let's say, is 17 and you are planning to apply for the Now and Comp waiver, before completing the application, please take him to a psychologist and tell that psychologist, listen, I need a psychological evaluation with an IQ test score because I'm planning to apply for the Now and Comp waiver. If your psychologist, if the provider that you are taking or that you are choosing is a serious one and is a professional one, they are going to know exactly what they need to do once you say, I need this evaluation for the Now and Comp. If you don't find any providers, please call us again at parent to parent. Well, Social Security, the developmental evaluation, okay, the IEP, the school's transcript, if your child is being served by book rehab, or if at a certain point your child was working. If your child is a permanent resident, you will need the green card. If your child is getting Social Security benefits, the letter, any other reports, etc., you are going to have to gather them. But the most important, I would say, is the psychological evaluation. Okay, so after you apply, this application goes to a review. Okay, a psychologist is going to review it and is going to say, yes, this person is eligible. So they're going to determine the pre-eligibility. Okay, and pre-eligibility means they have an intellectual deficit, they have an intellectual disability, they have a developmental disability, or they have a physical disability, or they have an intellectual disability. And once they say, yes, all this is covered, or this is present in this person, then you're going to be assigned to a planning list. Okay, so they're going to send you the approval, but the approval is not meaning that you are getting the service. The approval is saying, yes, you qualify, you are determined to be pre-eligible, but now you have to wait. Okay, so what moves a person from the planning list? So again, excuse me, and you are going to be placed, that person is going to be placed in a planning list. So how do you move up or down in the planning list? Okay, so the criteria is the criteria of the most in need. So in other words, the worst the person is doing, the less support the person has, the most needs the person has, the more chances are that he's going to be placed in a better position in the waiting list and given the service as soon as possible. So it depends on the health and safety that is surrounding that person, the caregiver and support system, etc., etc. So this is why, for example, sometimes I hesitate to say somebody that the child is 7 years old to place him in the waiting list, because he's gonna stay in the waiting list forever. And the reason is if I have to give priority, I'm going to give priority to a person that has already left the school, has no supports, is doing nothing, sitting at home all day long. Parents are getting older. They have physical disabilities as well. So that person is most in need versus a child who is 7 years old, has a good home, is going to school, is being taken to therapists, etc. So that's the criteria of most in need. Of course, this is not my opinion or the person that is doing the application, is reviewing the application opinion. The assessment is based on what we call the support intensity scale. There's a nursing report, there's a behavior assessment, the social worker is going to come and see the child, etc., etc. And then they're going to see if there is funding available. I'm sorry. And if there's funding available, in other words, does the state have money or how many slots has the state approved for this year? Well, then if the funding is approved and is enough, hopefully you get that magical saying, hey, your child is approved and he got the funding for the now waiver or the comp waiver, and then the service start. Okay, so instead of having an IEP, the person is going to have an individual service plan. And in that, as you can see here very fast, that service, the services that the waiver cover, it can cover therapies for adults, behavioral supports, community living supports. So for the person to continue living in the house, living in a group home, environmental accessibility, that means modification of the bathroom, the bedroom, etc., vehicle adaptation, supplies like diapers, etc. So, and you're going to think, well, why is Patricia talking about now and comp? Basically, the difference is the money. The now waiver is for people that are planning to spend less than 40,000 a year. And this is not for people that are planning to live in a residential setting, meaning in a group home or in any type of institution or residential setting. Whereas the people that require services that have a cost of more than 40,000 or that they are planning to live outside their home in a residential setting, they will have to go to the comp waiver. So I'm thinking that I'm done. I'm going to, it's 7:01. I know that I rush, but again, please contact us if you forget about our name or my organization or etc. You can always contact Lisa Lake. She has my contact. You also have received the flyer. You have the name of our organization. Please don't hesitate to call. And I think that's it, correct?
Yes, you did a fantastic job, Patricia. We have a couple of questions.
Absolutely.
There's if you look down on the Q&A section, you have there's some questions in here. Some of them are in Spanish. If you're able to just read the question first for the ones that are Spanish, in Spanish for everyone else to hear.
Okay, I don't see anything here.
Do you oh, you might have
Oh,
to.
the chat. What about the chat?
It's actually in the little Q&A section that's at the bottom of your Zoom screen, like where all of the icons are, where you can see like the chat, the share. You might, I don't know if you have to stop sharing in order to be able to see it.
Maybe stop share. Okay,
You
yay.
see
Okay,
it? Okay.
I did it. Okay. Okay, so Q&A. Yes. Okay. Okay, so I'm going to I'm going to read the question in English and in Spanish. Okay, so what age can we apply for the waivers now and comp? My daughter is 17, turned 17 this October, has autism, other medical chronic conditions. ¿A qué edad podemos aplicar para los waivers? Si mi hija tiene 17, autismo y todo lo demás. Ok. You can apply whenever you want for the waivers. The problem is that the waivers have a waiting list, and the criteria for the waiting list is the most in need. So if you have a child who is 17 and is getting the services at the school, probably they are going to look until she finishes school to give her the waiver. Now, you can do the application now, but she's going to be at least 3 or 4 more years there waiting in the waiting list, okay? Because you put the criteria of the most in need before. Excuse me, interpreter, do I need to interpret this, or you did it?
No, the interpreter is gonna stay in the room and they'll be interpreting what you say.
So probably he repeated that. Okay.
Yeah.
So so the criteria is most in need. So evidently, unless the child has, but even if I want to clarify this, some people may be thinking, okay, but I do have a child who is 7 years old and has severe physical disabilities, and why not put it in the waiver? And I'm going to answer you. You do not go to the now and come waiver. You go to GAP, which is the Georgia Pediatric Program. We have not talked about GAP here. That was not the purpose of the presentation. But the GAP is the Georgia Pediatric Program for children that have severe disabilities and need a skilled nursing. The mother needs some respite, a personal care assistant, etc. There's no waiting list there. The child must have Medicaid. So again, if anybody has questions, please call us in person tomorrow and we can work on this. So are there options for children over 18 who have not applied for the Medicaid waiver yet? Well, you're going to be running out of options because remember, for example, Medicaid, the low-income Medicaid ends by the time the child is 19 years old. Kathy Beckett is going to end by the child is 21 years old. So you can apply for SSI when the child is over 18 and you're gonna get Medicaid. But remember, Medicaid after 18, there are a bunch of things that they don't pay. For example, therapies. They don't pay therapies after 18 or 19, they are not going to pay for the diapers. So why wouldn't you apply for the Medicaid waiver if the child is 18? Go and apply, okay? Because you're gonna go to waiting list. So what if we have a IQ 78, but different for recent testing and level 3 of autism, ADHD, and issues with the right leg? Well, this is why if you I don't want you to have missed when I said the now and comp waiver is going to look for a psychological evaluation less than 3 years old. Because if you're applying when the child is 17 years old and you're showing an evaluation, a clinical psychological test done when the child was 10, maybe at 10 his IQ was 78. But now that he's 17, his IQ decreased and he's no longer 78 and now he's 68. So that's the importance of, again, taking the child to a psychologist and get an updated evaluation. So I would say, look again, how recent is that testing? Look again the IQ that he has there. But excuse me, I dare say you cannot have a level 3 of autism with an IQ of 78. Most probably the IQ must have, is going to be a little bit lower. So if you, mommy, that wrote this, have questions, please call me back tomorrow at Parent to Parent. Ask for Patricia, they will transfer to me, okay? Do you still need to apply for SSI first and be denied before you can apply for Kathy Beckett? No, it's not a must. If you have the denial letter, go ahead and submit it. If you do not have the denial letter, You can, when you fill the application form for Kathy Beckett, there's gonna be a form saying Medicaid eligibility, and you will have to put there your income, resources, how many cars, et cetera, et cetera. So if you complete that Medicaid income, that's the same as getting the SSI denial. So either one is enough. Do you have to renew eligibility for Kathy Beckett every year? Renew eligibility every year, not eligibility. You renew the form, but eligibility is renewed every 3 years. So every 3 years, you will have to comply with, again, showing the reports, the psychological, et cetera, et cetera. Thank you so much. Are your slides available? I think that my organization, Parent to Parent, provided Lisa and the DeKalb County Schools with the PDF and the handouts. So, mommy, you will have, or parent, you will have to ask for them. At what age does the application for the Now and Come begin to take place? Again, you can apply tomorrow. Doesn't matter how old is your child. The problem here is the waiting list, and priority to get in a better position in the waiting list is the most in need. So as a general point of view, if your child is no longer in school, he's going to get priority versus a child who, again, is in 3rd grade, goes to school, has activities there, etc. So you can apply whenever, but I would put my energies, after the child turns 16 or 17 to start getting it all together in place. May I see the first 3 slides? The first 3 slides, Kenisha, were the presentation where I introduced my organization and myself. So, okay, is there a specific deadline to apply for Kathy Beckett waiver after a Medicaid denial? So I'm not clear, again, Heather, what do you mean with this? It's a Medicaid denial, but you will have to tell me, if you can put in the chat, what type of Medicaid denial. You get a Medicaid denial for the low-income Medicaid, for the SSI Medicaid, or what are you talking? Again, Heather, if you can elaborate a little more. Okay, I don't see any more questions here.
And Patricia, I think she may be asking, once you get the denial, do you have a certain amount of time? After that?
Once you get the denial for the Kathy Beckett,
Mhm.
I'm almost sure that there's a deadline there to apply. When they send you the denial, they're going to give you a letter. This is not going to be verbal. You're going to receive a letter by mail, and they will say your child that has been denied based on a technical reason or based on the level of care. And if you want to appeal, you have, I think it's 60 days, but I can't put tell you exactly pinpoint the date. But be on the lookout for that letter. It's going to tell you how to appeal and what's the deadline, okay? Is there any way, I have a link again, anonymous, I would say, call the forces in the DeKalb County Schools. Okay, so thank you, Anonymous, for this. I forgot to mention, I should have. I have Medicaid for my kids, but it's so confusing because they are with CareSource. So some medical providers send letters saying that they are not in network. So if a parent tells me that their child has CareSource or Amerigroup, or I think the other one is WellCare, I immediately know that that child has the Medicaid for low-income families. If you have either of these 3, so in other words, if you have a white and blue card, and then the card that has the little, no, excuse me, it's Peach State, CareSource, and Amerigroup. If you have any of those cards, that means that your child has the Medicaid for low income. You do not have the Medicaid for SSI. You do not have the Kathy Beckett. So my question for this parent would be, if your child has a disability, why didn't you apply for SSI? Nobody told you, or you think the severity of the disability is not enough. So Anonymous, again, please call me tomorrow. We can discuss, ask for Patricia, because this is a very particular situation. I can give you the guidelines. I agree, Mommy. Medicaid can be very confusing. Nobody told me anything. This is why parent to parent has these collaborations, in this case with Lisa and the special ed department in DeKalb County, because you parents, you are not born with a booklet under the arm saying this, and this is available. You have to find it by themselves, and sometimes it's very hard. So use the people that know about it. Use me, use my organization, ask Lisa, and we can guide you. I can try to explain you. I used to be a teacher, so I love explaining things to people. I try to find different ways so you understand exactly. Between Medicaid and straight Medicaid, that's the same thing. When you say Medicaid and straight Medicaid, that's the same thing. I would prefer the term Medicaid with SSI or low-income Medicaid or Kathy Beckett Medicaid. The only reason I prefer this is because the low-income, emphasis again, low-income Medicaid is for all children. They can have or they cannot have a disability. But the SSI Medicaid is only for children that are disabled. The Kathy Beckett Medicaid only for children that are disabled. So that's the difference. Now, if you as a parent, your child has two cars, the white and then the other one for a Mary Group, WellCare or Peach State, that immediately is telling me that you do not have a straight Medicaid. You have the Medicaid for low income. So if you move out from DeKalb County while the application has already started, will it make any changes? No. If you move DeKalb County, well, let's put it this way. The office that looks after the waiver is called the DBHDD office, Department of Behavioral Health and Developmental Disabilities, and it has divided the state in 6 regions. So DeKalb County, Fulton County, Gwinnett County, I think Rockdale and Newton, they are all in Region 3. So if you move from DeKalb to Gwinnett, that's not going to be a lot of difference. But if you move from Gwinnett to, let's say, Catoosa County. Catoosa County is on the top near the border with Tennessee, if I'm not incorrect. Chances are that you are going to be in a better position in the waiting list. Why? Because that region has less people with disabilities in their population versus the people with disabilities that live in metro counties. Okay, so in other words, if you live in a rural area, probably you will be in a better position on the waiting list and you are going to get the service earlier than if you live in Gwinnett or the metro area counties. Moved to Dallas, Georgia. Dallas is Paulding County. I really don't remember where Paulding is, but if Paulding is with Cobb County, probably they are going to have a waiting list. I'm sure that if you call DBHCD, they can guide you further on exactly finding how many people are in each region. GAP services. Perfect. So GAP is very important. Just take this information. Again, GAP is for children that the parents need a personal care assistant or some respite care hours, or they need a skilled nursing. So GAP is another option. GAP does not have a waiting list. The child needs to have Medicaid, okay? Anything else?
Patricia, you have done a fantastic job tonight. Thank you so much.
I'm very glad, and anytime that you need, Lisa, if you have parents that don't want to call me directly, they want to go by you, that's okay. If you have any questions, please call me. Don't leave this presentation with questions. Just call me tomorrow or whenever I'm available. to answer as much as I can. And this is my motto. If I don't have the answer, I will find it for you. So don't worry about that.
Yes. And
Something very important that I wanted to mention now, also, this is very new. I don't know if you know it, but starting in October, Medicaid after 19 years old, which is basically the people that are in the waiver or people that have SSI, dental services are covered everything. Remember that after 19, we only had dental services in terms of extractions. Now, thanks to all the people in the state of Georgia that had done a wonderful job advocating, everybody that has a Medicaid, even if they are adults, they are entitled to have all the preventive dental services, consultations, doctor dental visits, etc. That's important. Yeah, I was like, yeah.
that's good news.
Fantastic news. So I can elaborate more, Lisa. If you want the manual, just let me know and I can send it to you tomorrow if you want. Okay.
Yes, that would be fantastic. And I'm going to answer this last question, which is asking
Sure.
about the access to recordings. So the sessions that we have done so far, we did one in October on transition services, one in November on guardianship, and then the session for today. These sessions are all being recorded and they are going to be uploaded to the DeKalb County School District's YouTube channel, and then they will be placed onto our exceptional education website page. With the exception of today you will not be able to see the full presentation, but you will be able to see all of the questions. And we'll have a frequently asked questions section also added. So if you will just be patient with us. We're going to get these recordings added up to the website soon. So they're coming within the next few weeks. And I will also be emailing out everybody that registered. As soon as these recordings are ready and available to be viewed, I'll be sending them out to everyone that registered and letting you know that they're available. You guys will also get an email from me tomorrow with the survey, with any handouts that Miss Patricia sent from Parent to Parent of Georgia. I'll also send their information. It'll be in an email, so everyone will receive that email, as well as upcoming sessions. And our next session is on hospital homebound, as well as Section 504. If you have a 504 plan and you need to know more about that, your child gets sick, you have an IEP, you need to do hospital homebound, you can't come to school. We're going to be talking about all of those things in January. And then, of course, more information is coming about our transition fair that will be held in March. And I think Parent to Parent is going to be there. So just lots of great things coming. Lots of great things coming. Please complete the survey. Thank you all for coming tonight. And we hope to see you at our next session, and have a great night. And thank
Okay,
you,
interpreter,
Patricia.
if you can tell the families in Spanish that we do have I bilingual in Spanish, and there's also on the co-worker that speaks Spanish, so don't hesitate to tell them to call us. Okay.
Yes, Spanish speakers can be accommodated at Parent to Parent.
Yes.
And I think you guys have other languages too. Is that correct?
Yes, we can use language line for the others, but
Okay.
for Spanish it's me and Irma. So
Got it. So there's no reason you cannot
no
get
reason.
what you need. If you contact Parent to Parent, doesn't matter what language you speak, they will find a way to communicate with you. And you can also contact me for additional information if you're not sure where else you need to go. And I think we're done for tonight. But
Okay.
thank you all for coming, and thank you, Patricia, again. You were fantastic.
A pleasure. Thank you every time. Take care. Bye-bye.
Have a good one.